So the one thing they said was just to, when you're giving it to her, to make sure you're on the side.
Yes,
so
I
you're
will.
not kind of blocking the photographers.
I absolutely will.
So you can just kick it off with a, we're excited to be here.
Yeah, absolutely.
Another
And I'm going to hand this
milestone
right
day.
back to you, and
Yep,
then you
yep,
hand it to me when you're done.
yep.
All right. Hello, everybody, and welcome. It's an exciting day. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we are going to start off today by vaccinating 4 Chicagoans, starting with Mayor Lori Lightfoot. And just like I gave you your flu shot back a couple of months ago, I'm actually going to do the honors and do the COVID vaccine for the mayor. And then we'll move on and do introductions and move through the other individuals who are being vaccinated. We do have to obviously take a few minutes to make sure that people have had the chance for the observation time period, and then we'll move into the formal remarks. All right.
Thank you. This is obviously an incredibly important milestone on our COVID-19 response journey. We're going to be announcing here in a few minutes the official start of 1B, and my phone and text messages are ringing off the hook because while there still remains vaccine hesitancy, and we'll talk about that in a moment, I think increasingly people are optimistic and hopeful and recognizing the importance of what this vaccine will mean to their lives, because literally it will save lives. So I'm a little nervous, I will say, as I always am when I get a shot, but I'm excited to prove and demonstrate, I think, to Chicagoans, particularly in black and brown neighborhoods, that this vaccine is safe, and that it will save your life. So with that, I'm ready.
All right. So first I'm just going to... All right, so this was the Pfizer vaccine. Any comments? Did it hurt?
No, it felt like my experience in getting a flu shot. In thinking about the vaccine, I've been remembering when I was in elementary school, and we had to get a rubella, I think, and measles and mumps shot. We all gathered at a local elementary school and marched through the line. And so I've been thinking a lot about that and that experience. But no, I felt fine. I'm sure there'll probably be a little soreness in the arm later. But going in, everything was fine.
Sounds good. All right, so as always, we watch everybody for 15 minutes. We have not been seeing unusual problems here at all, but it is a matter of fact, and we monitor and are ready. So I think with that, we will move on. Next, who will be doing next over here? Do you want to introduce yourself?
Yes, my name is Mariano Kebukola. I'm a pharmacist here at St. Bernard Hospital.
Okay, great. And would you like to introduce yourself?
And I'm Dr. Helene Gale, President and CEO of the Chicago Community Trust.
All right, and tell us a little bit about why you're getting vaccinated.
Well, I'm getting vaccinated because I want to go on record to show people that it is safe and that it's important for all of us to take this vaccine. It's what's going to make the biggest difference as we try to get past what has been a really difficult time with COVID pandemic, both from the health impacts as well as the economic impacts. So, I'm just here as part of the 1B group to show my support for what I think is such an important citywide effort.
All right, thanks. And there's paperwork. Whenever anybody gets a vaccine, you have to fill out some paperwork. Obviously, we ask about any history of allergies, make sure people are not having any COVID symptoms right at the moment. And then move ahead.
Not bad at all. In fact, that was better than my flu shot. So I hope it helps to demystify this whole process. Thank you.
Thank you. And each person does get the same card all over the country. So regardless of where somebody gets a COVID vaccine, there's a card that you get that has the type of vaccine that you've gotten, in this case Pfizer. It actually has the vial number. So 5 people can get vaccinated out of a single vial from Pfizer. And so we record that number and then the date and the site. This also is, and there's yours, this also is reported electronically. All information is kept secure and only available through public health agencies. But it's important that we keep track of what type of vaccine people are getting so that when it's time to get that second dose, you make sure they're getting the right second dose at the right time. All right. And third here, will you be doing the vaccinating again? Okay, we'll let that happen first. Yeah, we'll get you set up for your second dose. Do you want to, I just want her to introduce herself.
Sure. My name is Sylvia Puente, and I'm here in my roles as head of an organization called the Latino Policy Forum, and working with an organization called, or a coalition called Illinois Unidos, which has worked very, very hard to develop a response to the COVID crisis in the Latino community, which we know has been disproportionately impacted. And my basic message is COVID kills, vaccines save lives. And that's why I'm here today to encourage all people, but especially those that are hesitant in the Black and Latino community, to save a life. Get your vaccine when you can.
All right, thank you.
It hurt a little bit. Obviously, just the tension and the release of getting a shot and never having it been on full display of a camera before. But thank you. Thank you.
All right. And fourth, our same vaccinator, or are you going to do it? Introduce yourself?
Yeah, good afternoon, everyone. My name is Magellan Yudao. I'm the pharmacy manager over here at the Ambulatory Care Center at St. Bernard Hospital.
All right, thank you. And being vaccinated.
Thank you. Good morning, afternoon, everyone. My name is Roderick Sawyer. I serve as Alderman of the 6th Ward and Chairman of the Mayor's Health and Human Relations Committee. As a Black man, I particularly thought it was important to see someone like myself get vaccinated because there's a lot of discussion, justifiably so, about particularly Black people, particularly Black men's hesitancy about getting a vaccine, and I want to show that it was safe. And I thought it was important for me to be out front and showing that, both in my job as chairman, but again, as a Black man, that we can continue to have the discussion about health disparities in America, but this is something that's overwhelmingly important. As everyone stated, vaccines save lives. So I'm here to get that today.
All right, thank you, Alderman.
No problem at all. Great. Thank you.
All right, thank you. So we've got a few minutes that folks are going to sit, and I think we'll talk just a little bit about what happens after somebody gets vaccinated. So first, we always want to think about the second dose. So in most situations, people are getting that second dose appointment really at the same time that they're getting the first dose. Our best practice here in Chicago is that you get the second dose on time. So for Pfizer, that's 3 weeks later. For Moderna, that's 4 weeks later. And generally at the same place where you got your first dose. Sometimes when we're doing some with the cameras, there may be slight variations. But for general Chicagoans, you get your same dose on time at the same place. And we're making sure that you're getting lots of reminders about that. So first, in most cases, you're getting that appointment even before you leave. But then, if you're getting it through one of the City of Chicago sites, there's text messages that come. And for everybody, they get information about something called V-Safe. It's the last page in these packets that people are looking at, and I already gave the mayor hers in advance. V-Safe is a program that's run by the CDC. It is optional, so you do not have to enroll, but there's a QR code, so you can put your cell phone on it and say, I just got a vaccine, and then the program texts you once a day for the first week after the vaccine, and then spaced out after that. And it asks, did you have any side effects? Do you have any issues? Is there anything we need to be aware of? It also asks, for women, if they might be pregnant. We want to be following people who are pregnant and make sure that the vaccine is safe and effective as all points indicate that it is. So we're looking for some additional data on that. And it checks in with you daily, and then it spaces out to weekly. It also reminds you that your second dose is due. So in addition to the work at the local level, at the national level, they want to send you that reminder. So I got my second dose just last week. I actually did not have side effects. Honestly, I told the app maybe a little bit of a sore arm, but did not have really anything. Sometimes, people report some fatigue or feeling tired or some headache. To be perfectly honest, I'm a little bit fatigued all the time right now in COVID, so it's a little hard to differentiate, but I didn't feel more tired than I normally did. And certainly, as someone who's gotten both doses of my vaccine, it helps me breathe easier because I know that I am protected, particularly against being hospitalized. It helps me feel more secure, if I'm going to see my mother or older people, et cetera. But I have not, you have noticed, stopped wearing this mask, and I will not stop wearing this mask. We keep masking, we keep social distancing, we keep doing the things that we know work. These vaccines are amazing. 94 to 95% protective against COVID in the clinical trials with a fantastic safety profile. Like, really couldn't have been better in terms of what we were hoping for right out of the gate with the first COVID vaccines. But we do know that even a 94 to 95% protection rate means that if you're exposed to COVID, there's still a 1 in 20 chance that if you're not doing all the things that help, you still could become infected with COVID. So while COVID rates are really high here in Chicago still, although they're getting better every day, everybody keeps doing the things that we know work. The vaccine is at the center of Protect Chicago, but it is just one piece that adds on to everything else. So every time we do one of these events, I'm really happy because it means every shot in arms, adding on to the more than 100,000 Chicagoans that have already gotten their first dose, that takes us one step closer to getting past COVID. All right, we are at 1:15. Did we start pretty much right on time? Okay, then I think what we'll do is we'll have folks, just we did it in the speaking order a little bit, so to make sure people would have their time for sitting. All right, so we're gonna move ahead. Yeah. Yeah, and people can go ahead and move. And yeah, just as a clarification.
Check his focus.
Mic check, testing 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. Mic good?
I want to get some more clarity. Now, on the 15th, I'm supposed to, I can just come straight.
Mic check, testing 1, 2, 3.
Calling it I can just come straight here, no appointment necessary. I can just come here on the 15th and just get my ticket. Okay. That's all I need to know. I will. Thank you. Yes. I appreciate it.
Generally, we keep the mask in and take it off.
Good afternoon, everyone. Good afternoon. I'm Charles Holland. I'm the President and CEO of St. Bernard Hospital, and I thank you all for being here today. I would in particular like to welcome some special guests who have joined us. They are Dr. Allison Arwady, Chicago's Public Health Commissioner, Alderman Roderick Sawyer, Alderman Jeanette Taylor, State Representative Sonia Harper, Dr. Helene Gale, President and CEO of the Chicago Community Trust, Sylvia Puente, Executive Director of the Latino Policy Forum, and Father David Jones of St. Benedict the African Catholic Church. Like every hospital in the world, St. Bernard is filled with heroes who have courageously served patients directly and indirectly affected by the coronavirus pandemic. And today, we have another hero with us who is here to lead by example, Mayor Lori Lightfoot. The mayor has heroically faced challenges no one could have foreseen due to the pandemic. I can say from firsthand experience that the mayor and her administration have been instrumental to our efforts at St. Bernard and to the citywide healthcare community as we've worked to treat patients and stop the spread of the virus with equity as a guiding light. The vaccine is now here, and we realize many people have concerns about it. Concerns and skepticism run especially high in the Black and brown communities we proudly treat, and those concerns are understandable. But we simply must stop the spread of the virus. We must prevent the deaths that are tearing apart families every day. For that reason, I have taken the vaccination, and I urge everyone to do the same when they get the chance. We are proud that Mayor Lightfoot has chosen St. Bernard as the hospital where she received her vaccination. I also thank the other leaders who are here getting their vaccination as well. The power of their example sends a strong message to communities that have suffered the most. We have the resources here to help the community, and Mayor Lightfoot, we thank you for shining a light on the need for vaccination and the ability of community-based institutions like St. Bernard to meet that need. Mayor Lightfoot.
Thank you.
Thank you.
Good afternoon, everyone, and thank you all for being here. Let me also thank St. Bernard CEO Charles Holland, along with all the other healthcare workers that are here. We've been in this hospital before. We know what an important anchor this hospital is for the Inglewood community, and we just want to thank you for everything that you've done every single day, but also over the course of this pandemic. And that includes redesigning your spaces to accommodate COVID patients, launching a mobile COVID-19 testing program to bring testing into this community, and hosting virtual staff town hall meetings to answer vaccine questions and provide crucial information. Your work has saved lives and continues to save lives. So thank you, one and all, to this St. Bernard community and the South Side and our entire city. I also want to just say, on a personal note, we all know that the safety net hospitals are challenged in these times in particular. And I want you to know that I intend to be directly involved to do what I can to make sure that you have the resources that you need. The vital role that the safety net hospitals play all over Chicago, particularly in communities of color, cannot be overstated. So I will be there, we will be there, we will make sure that we support you. I also want to extend my gratitude to the other speakers who are here today. Alderman Roderick Sawyer, Chairman of the City Council Committee on Health and Human Relations, and I really thank you for your words, Alderman, there you are. It's important that Black men lead by example, and Alderman Sawyer does that every single day. So I want to thank you for what you're doing. Can't say enough about Dr. Helene Gale. I was joking before we started that every couple of weeks she and I need to get together in public. But really has done incredibly heroic work in championing the cause of everyday Chicagoans. So Dr. Gale, thank you not only for your leadership on the national level in advancing equity in the distribution of the vaccine, but thank you for everything that you do for us here in Chicago. I want to also acknowledge Pastor David Jones of St. Benedict the African. Thank you, sir, for your hard work and everything you do here. Sylvia Puente is somebody that I've known and respected for a long time. She's a fearless leader, a fearless advocate on a number of different levels, but particularly for Latinx Chicago. Thank you, Sylvia, for everything that you do, leading on the Latino Policy Forum and being a member of Illinois Unidos as well. And of course, we wouldn't be here, we would not have survived these very difficult times without our leader in public health, Dr. Allison Arwady. I also want to acknowledge the other leaders who are joining us here today. Alderman Gil Villegas, I think, is on his way and will be joining us. He is a Alderman of the 36th Ward and serves as chairman of the Committee on Economic Development. Alderman Jeanette Taylor of the 20th Ward, which is right where we are situated, and a fierce advocate for her community. And of course, Illinois Representative Sonia Harper, who represents this community bravely, fearlessly, and unapologetically in Springfield. Thank you for everything that you do. I want to speak to the moment that we are in now in our long journey in the fight against COVID-19 that has brought so much heartache and fear to so many across Chicago. We are here to make two important announcements today. First, I am pleased to announce that we are, in fact, moving into Phase 1B of our vaccine rollout plan, which is a cause for celebration. Starting today, vaccinations will now include all Chicagoans aged 65 years of age or older, as well as individuals living in non-healthcare residential settings such as homeless shelters and correctional facilities. 1B also encompasses our frontline essential workers. These include, but are not limited to, our first responders, our grocery store workers, our education and daycare workers, our construction workers, along with those in correctional facilities, our public transit, manufacturing, agricultural industries, and those supporting the continuity of government, as well as our postal workers. Now, Dr. Arwady will be providing more details on 1B in just a moment. But this is an important milestone, and I want you as Chicagoans to know we are ready. We have built the logistical infrastructure with our healthcare partners across the city, and we are ready to go. All information on our COVID-19 vaccine rollout can be found at our website, chicago.gov/COVID-VAX. That's COVID, V-A-X, chicago.gov/COVID-VAX. And our hope is to pass through Phase 1B over February and March, and then transition to 1C by late March. I now want to address a significant challenge that has existed throughout this pandemic, and one that we must rise up again together to meet in this next phase of our response. And the challenge is this: unexpectedly low numbers of Black and brown Chicagoans have taken the vaccine so far. A percentage that is so alarmingly low that if we do not reverse this trend, we will continue to see more Black and brown fathers, mothers, grandparents, sons, daughters die of this virus when a vaccine is right here, right now, for free for all. We know since the beginning of this crisis, Black and brown individuals are disproportionately affected by this horrible virus. The underlying health conditions born of systemic racism, lack of access to good quality health care, the food and pharmacy deserts, and the just plain deserts of hope and opportunity, rob too many communities of the tools we all need to be able to thrive and live vibrant lives. The conditions are also, unfortunately, a perfect breeding ground for the disastrous healthcare outcomes seen when this virus gets even the smallest foothold in a body that is already struggling. We are getting sicker at higher rates, and we are dying at higher rates. Now, as a city government and with trusted local leaders, we have been laser focused on these disparities since the early days of the pandemic. We have gone door to door, passed out PPE, worked to educate and connect people to local healthcare providers, tried to bust through myths so that we could address concerns with facts and the truth. And we have and will continue to bring testing to those neighborhoods most in need. And still, despite all of these efforts, we have too many neighborhoods and zip codes plagued by high case rates and soaring positivity rates. Now, we have not been discouraged. Instead, we have been determined to save lives. And as we enter this next phase of the pandemic response, as we open up the vaccine to more Chicagoans, I am here as your mayor to speak another hard truth and implore you to take steps in our direction so that we can continue to save lives. Vaccines came to our city 6 weeks ago. Since that time, nearly 108,000 Chicagoans have received their first vaccine dose. But based on an analysis done by CDPH, only approximately 17% of those people are Latinx, and worse, only about 15% are Black. Our city is 2/3 people of color, and yet we are falling woefully behind in a number of people of color who've been vaccinated to date. Those are numbers that simply cannot stand. And based on a recent survey by CDPH, those that are the sickest, meaning those that have the most severe underlying conditions, who need the vaccine the most, you are the most reluctant. Now, we're sharing this data because we believe in transparency. And we're sharing this data because we want everyone out there who is scared, who is reluctant, or just needs more information. To those of you who are hesitant, we are here to tell you the vaccine is safe. And we want you to take it because it is safe and because it will save your life. We want you to know that not only do we believe it's safe, we took it ourselves. We want to do everything possible to break through the noise, to address your fears, and anything else that may be holding you back from taking this life-saving vaccine because, and let me say it again, we want to save your life. Now, as CEO Holland said, there are many current and historic reasons why people of color in our city and across the country are reluctant to take the vaccine. We understand that. This reluctance exists even among healthcare workers. I also know that in certain quarters, there is a great mistrust of the government or fear of what can happen if you or a family member come into contact with the government. And let me just say this, don't judge us by what we say. Judge us by what we have and what we continue to do for you in your communities. By and through trusted community partners who you know and live in your neighborhood every single day. We have been there with you every step of the way during this whole pandemic. And we are here for and with you again to help support you, your families, and your community through a new approach to vaccine distribution. And to address your vaccine reluctance, we've been working with community partners to help reassure residents that the vaccine is safe, that people of color were part of the trials and actually helped develop these vaccines. But to all the people who are still unsure, I want you to hear from me loud and clear once again. The COVID-19 vaccine is safe. This is what I am telling my 92-year-old mother. This is what I'm telling my siblings, many of whom have underlying healthcare conditions themselves. I trust my mother's life, my family's life with this vaccine because I have every confidence that it is safe. And as you know, just before the program started, I took the first dose of the vaccine myself, along with Dr. Gale, Alderman Sawyer, and Sylvia Puente, and we're going to get Gil Villegas his vaccine as well. But we want to go even further, and here's our commitment to you. To make sure that we are doing more to protect the lives of Chicagoans, I am here to announce another part of our Protect Chicago program we are calling Protect Chicago Plus. It has 3 key pillars. First, reaching those most in need. Beginning this week, and for the next 2 months, we are placing extra focus on 15 communities. Those that are the most vulnerable to this virus, to high case rates, to higher positivity, and to sickness and death. Neighborhoods like Inglewood, here on the south side, Austin on the west side, Belmont-Cragen on the northwest side, Archer Heights on the southwest side, and 11 other neighborhoods across our city. These are all neighborhoods that the public health data tells us continue to struggle, even now, 10 months into this pandemic. We want you to know even more help is on the way. Second, a key pillar to Protect Chicago Plus is dedicated vaccine resources. What kind of help? dedicated vaccine doses that we will be bringing to you in these 15 communities. We will be prioritizing getting vaccines into the hands of local providers in each of these 15 neighborhoods. Providers who have made a commitment to aggressively engage the respective communities to break through the barriers, demonstrate why the vaccine is safe and essential, and get doses into arms, again, folks, for free. These same providers will be there for you from the first shot to the second and thereafter. Third pillar of our new and innovative Protect Chicago Plus is barrier busting. We do not want there to be any reason why people in these communities who are most in need don't get the vaccine if they want to take it. We will be on the ground in these neighborhoods in a concentrated and accelerated way at tables that have already been set with our partners. We want to address every issue that is resulting in reluctance to take the vaccine. And we have aggressive goals to reach people and get them vaccinated, all to save lives. We will, of course, be continuing our vaccine push in all parts of the city through established healthcare providers, mass static sites, and mobile resources. We need to get a critical mass all across our city to truly protect all of Chicago. And together, there is no mountain too high that we can't climb. As I've said many times before, equity is not part of our COVID-19 strategy. It is our COVID-19 strategy. To our communities hardest hit by COVID-19, I want you to know we still are here with you on this journey. We are supporting you, and we are doing everything that we can to make sure that you and your families get the care they need. We will always lead with equity, because leading with equity is not only the right thing to do, it is our surest path out of this crisis and into recovery. We all need to support each other and hold each other accountable. Lives are at stake. And as exciting as this day is, it is also, make no mistake, a call to action. A call signaling that we will not rest while there are disparities of any kind. Not now, not in this moment of continued crisis, but also we have to recognize this as a continued opportunity. Throughout this pandemic, the wrongs of the past have been laid bare. We did not avert our eyes, and we will not now. We cannot build a more equitable and inclusive city if huge swaths of our residents are left behind. That is not the Chicago that I want to live in, and I know that's not the Chicago that you want either. That is not true just for economic development purposes, but also in terms of basic human rights like access to affordable, high-quality health care. And right now in this moment, that means getting vaccines to people who need it most. We cannot and will not fail on this most urgent, life-saving mission. And regardless of the challenges we face, we still continue to move forward in our journey to vanquish this disease, to get our economy back on track, to get our lives back to normal. We all want to be with our families and friends again. And this day when we are entering into 1B brings us that much closer. I want to thank all the Chicagoans once again who throughout this 10 months of hardship have been doing your part to step up, to keep yourself safe, to save lives of your neighbors, to the sacrifices that you've made, giving of your talent and time and resources. This is who we truly are as Chicago. It's because of you and the choices that you made that we continue to see our numbers significantly decline. That and above all else has been the key to our success, each of you, understanding the moment, taking advantage of the opportunities to be brave and to be bold and make the sacrifices that are necessary. On behalf of a grateful city, I want to say thank you. I want to say thank you and persevere, because we need to stay in this together. The worst, I hope, is behind us, but we still are not out of that tunnel. The light's there, and we're hopeful, but we still have to persevere. And now it's my pleasure to welcome Commissioner Dr. Arwady to the podium.
Thank you, Mayor. We're going to be posting a lot of information on the website for people who would like to see additional details related to data, community areas, and plans. But I want to just speak at a high level about why we're taking this Protect Chicago Plus initiative and how that fits into 1B. So 1 in 25 Chicagoans has already gotten their first dose of COVID vaccine. That's good. But when we look a little bit under the surface, only 1 in 45 Latinx Chicagoans and only 1 in 53 Black Chicagoans have gotten the COVID vaccine, which means we have a ways to go. We will not get past COVID as a city with some of our neighborhoods heavily vaccinated and some of our neighborhoods very under-vaccinated, particularly if those are the settings where COVID is flourishing, which is what we're seeing. Every opportunity to get a COVID vaccine into a setting where it helps stop the spread of COVID protects all of us. And so you heard that in phase 1A, we have been focused on our healthcare workers, on our long-term care facilities, on our settings where people with behavioral health or developmental disabilities live, because these are highly vulnerable settings, but they are also high risk for COVID spread. And with variants on the horizon, concerns about what's coming down the line, making sure as a city vaccine gets where it is most needed is the right thing to do from an equity perspective and the right thing to do to get us past COVID as quickly and safely as possible. The epidemiologists at the Chicago Department of Public Health have been looking every week at Chicago data to direct resources. Every week we say, where are we seeing potential surges of COVID? What does positivity look like? And then we direct resources, testing resources there. We follow up, we see where do we need to go. We've been using data, and it's been a big part of what has gotten us this far. We're doing the same thing for vaccine. We created this Chicago Community Vulnerability Index, which pulls together a lot of what we've learned about what puts people at risk for COVID. So it includes socio-demographic factors, things like the percent of people who are living in poverty, the percent that are living in crowded housing situations, but also the percent who are uninsured, and importantly, the percent that do not have a primary care provider, recognizing that in those settings, we're going to need to do more work to connect people to vaccine, given that many people, most people, will get their vaccine through a healthcare provider. Secondly, we pulled in occupational factors. So we looked at where do essential workers, and the way that we now define essential workers, live. Mm-hmm. So we're thinking about where do people who live in manufacturing, where do the grocery store workers live? Where do the transit workers live? Where do the folks in education live? Recognizing those are going to need to be settings where we direct additional vaccine. We pulled in epidemiologic factors, like where do we have a high percentage of people over 65? Of course, 1A opens to all people over 65, but neighborhoods with a lot of older people will need additional vaccine, as well as where do we see high rates of chronic diseases? Where we see a lot of people with chronic diseases in Chicago, that is where serious COVID outcomes flourish. And then finally, we looked at COVID data for Chicago. Where have we seen high rates of cases, high rates of hospitalizations, and high rates of death? All of that put together created an index for us that let us choose the 15 community areas where we are putting these resources. This does not mean that vaccine is not going to be available across the city. Of course it is. And as we move into 1B, as a very quick reminder, the top way people get vaccine is through their health provider. Check with your hospital, check with your primary care physician. We've got all the hospitals, more than 100 federally qualified health centers, more than 100 other providers already enrolled and giving vaccine, and that is happening by appointment. If we think about equity, we're not waiting for the people in their 80s and 90s to figure out how to do the internet and find an appointment. We are saying, providers, you know your patients. Please reach out to the patients on your list who are the oldest, at the highest risk. have the most underlying conditions, and bring them into the settings that they know. Answer their questions, build that confidence. That is the heart of our strategy, no matter who you are and where you live in Chicago. Secondly, through pharmacies, we have made vaccine available across more than 140 pharmacies. You can find links on the website to connect there. I will tell you, these are going very quickly, and it's going to take weeks and weeks to get through 1B. But again, we work to make sure there are vaccinating sites in every single ward in Chicago. Again, an equity perspective there. Thirdly, we'll be making vaccine available through employers. That again is by appointment, and we are bringing vaccine to the settings that are the highest risk for COVID. Already we're vaccinating first responders. We're vaccinating in the correctional settings. We're working on getting started with daycare, planning for education, pulling in these manufacturing settings. That is happening. You are still eligible, if you are a teacher or someone who works in these settings, to get vaccine today, but we know there's a lot of competition. So if you get it through a pharmacy, you get it through your doctor, no problem, but we will also be making vaccine available through your employer. And then fourth, the city of Chicago. We are standing up, as you know, some larger points of dispensing. These are what you've seen at city colleges. Let me be frank with you, every appointment at those sites is already booked with 1A healthcare workers. We are not done with 1A. And one note is that if you said maybe not no, but not yet to getting vaccine, and you were a healthcare provider, you wanted to see people get that second dose, now is your opportunity. And we really want, especially healthcare workers, as we've seen more and more data, millions of people, more than 1 million people on average getting vaccinated every day in this country. Data looks good. Please do take your chance. We also continue to push vaccine to more than 250 strike team locations. That's our long-term cares. We're adding on homeless shelters. So a lot is happening, but I urge patience. We have 34,000 first doses of vaccine coming every week. We have 363,000 Chicagoans over the age of 65, another 350,000 in those frontline essential workers. So we don't even get enough vaccine to vaccinate 5% of the people who would like to be vaccinated each week. So some patience as we roll this out, but we've built a system that can handle as much vaccine as it can come here, and a system built on equity. When you have a chance, please do the research and be ready to take the vaccine. And with that, I'm really pleased to bring up Dr. Helene Gale from the Chicago Community Trust.
First, I want to thank the staff of St. Bernard's Hospital, and particularly to my vaccinator. This was the most gentle vaccine I have ever gotten, so thank you so much. And thanks to Mayor Lightfoot and Dr. Arwady. I say all the time how wonderful it is to live in a city that has this kind of leadership, this kind of enlightened leadership, both in our mayor, our public health commissioner, and other city leaders who have shown such vision and such commitment to our response to the COVID-19 pandemic here in Chicago. And I have the opportunity to talk to a lot of cities around the nation, and really Chicago and its leadership stands out. So thank you for all you continue to do. I am pleased to be here to take my place in line in this next phase of vaccination, 1B, for key essential workers, people living in congregate settings, and then people like me whose length of time on this earth puts us at higher risk. We know, and it has been said many times, that this pandemic has amplified persistent economic and health divides between Black, Latinx, and white communities in Chicago, as it has throughout the nation. As a Black woman, a public health physician, and a leader of an organization that has put closing the racial and ethnic wealth gap as our highest priority, I am passionate about this vaccination effort and what it can do for the health and the economy of our city and our region. So passionate, in fact, that I am willing to admit my age publicly. So I am really pleased to be here today to show my personal support by getting my first dose of the vaccine publicly. Vaccines are our most potent tool against further deepening health and economic disparities, and they are key for accelerating the important work ahead of us towards an equitable economic recovery. As such, I am also pleased to announce that Chicago is one of the 6 cities that the Rockefeller Foundation has chosen as part of its Partnership for Equitable Vaccine Distribution. This is a program that is focused on efforts to protect communities that have been most impacted by COVID-19. The Chicago Community Trust will be awarded a $1.5 million grant from the Rockefeller Foundation to support community-led and community-driven campaigns centered around equitable distribution of the vaccine and vaccine uptake. This is along with additional financial contributions we at the Chicago Community Trust will make in the coming weeks. Through these resources, alongside the city's Protect Chicago Plus, the Vaccine Corps Partnership, and other key partners, we will work to make sure equity is a priority as vaccines are distributed. And while we know so many people are looking forward to getting the vaccine, as has been mentioned by the mayor, we also know there is a lack of confidence and trust in these vaccines in some of the most heavily impacted communities. Clearly, as several speakers have said, there are valid reasons why this lack of trust exists. But we have to challenge the mistrust and skepticism by providing accurate information, engaging communities directly so that everyone has the access and information they need to make the best decisions about vaccines for themselves and their families. I hope that as more people see people getting this vaccine safely, including people who look like them and who they can trust, they will feel more comfortable about getting vaccinated themselves. For most of us, this is clearly the right thing to do, but it is also the necessary thing to do. Having a highly vaccinated population is critical to bringing an end to the health and economic crisis we are all facing. So I hope people will be encouraged to take this vaccine when your turn comes for the sake of your health, the health of your family, and of our community. Thank you.
I am Father David Jones, pastor of St. Benedict the African Parish just down the street here in Inglewood, and glad to be here at the invitation of the mayor and with my own alderman and at St. Bernard Hospital, where good medicine is practiced with daily prayer. I've had many conversations with parishioners in this and members of this community regarding the vaccine for COVID-19. Last week, I was fortunate to receive my first dose. My arm was a little sore afterwards. It felt like it always feels when someone sticks me with a needle. I've heard a good amount of suspicion about this virus and now this vaccine. I get it. Suspicion is warranted when we are treated as a minority. But in the case of a pandemic, the good news is that we are all in this together. In this case, we are not a minority. This one is affecting people all over the world, which means we are not a minority. Most people in this world are people of color. We are a majority. If we get vaccinated, the majority of us, the world, is literally being saved. To not receive the vaccine means to return to minority status. This is literally a moment where there is strength in numbers, strength in science, and strength in medicine. We cannot beat COVID-19 alone. We have to beat this one together. The virus is yet another threat to Black lives. The vaccine allows us some power, some control, and hopefully some freedom. This moment is different because a new majority is emerging, a majority of people who are taking control of a virus that has killed too many Black people. We have never been on the wrong side of history. The facts, the science, the reality all inform us that this vaccine is necessary. This February is an opportunity to celebrate the future of Black community more than the history of what others did to Black people in the past. This time, we've got the numbers, we've got the power. Let's get the vaccine together. Let's save the world together.
Good afternoon. I'm Sylvia Puente, President and CEO of the Latino Policy Forum and a leader with Illinois Unidos, which is a coalition that has come together to address the crisis of COVID in the Latino community. I want to thank the mayor, Dr. Arwady, St. Bernard Hospital, just for your tremendous partnership and working together to address the crisis. I'm going to offer my remarks first in Spanish and then in English. Alcaldesa Lightfoot, agradezco la oportunidad que me brinde hoy para recibir la vacuna de COVID-19. Gracias. Mi familia y todos los que me quieren también se agradecen. Tengo la suerte de saber que no voy a enfermar y que mi vida no corre peligro. Los que me conocen saben que estoy trabajando con un grupo estupendo de colegas en el Latino Policy Forum y en el Illinois Unidos. Aseguramos de que todo el mundo tenga la misma oportunidad que yo, que todo el mundo tenga acceso a la vacuna o la posibilidad de realizar la prueba de COVID, especialmente nuestros trabajadores esenciales. Sin ellos, lo que permiten que nuestra economía, son ellos lo que permite nuestra economía sigue funcionando y a la vez son los que presentan mayores tasas de contagio. Estas personas no tienen el lujo de poder trabajar desde sus casas. Son los encargados de cuidar a nuestros hijos, de trabajar en las fábricas, de preparar nuestra comida y servirnos, y también de limpiar y desinfectar todo. Las comunidades latinas y otras comunidades de color se han visto afectados mucho más por el COVID-19. Demasiados han sufrido y fallecido. En Illinois, los latinos presentan las tasas más contagio mayores entre todos los grupos étnicos y o raciales. Si miramos con el conjunto del país, los latinos han sufrido más muertes que cualquier otro grupo. Si tienes dudas acerca de vacunarse o no, tengo un mensaje para usted. La vacuna es segura y salva vidas. El COVID es peligroso y mata. La vacuna se administra gratuitamente. Para más información, visite chicago.covid, COVID-Vax. Me complace saber que el alcalde Lightfoot va a priorizar las comunidades más afectadas en su plan de vacuna. Por favor, se lo ruego, vacunarse y mantenga a salvar a su familia y a sus queridos. Muchas gracias. So Mayor Lightfoot, Commissioner Arwady, and the fine folks here that vaccinated me at the hospital, I so appreciate the opportunity to receive the COVID-19 vaccination today, and so appreciate the efforts and the partnership that the Latino Policy Forum and Illinois Unidos has with the city of Chicago to address this crisis. Today, I thank you. My family and loved ones thank you as well. I am blessed to know that I can stay healthy and that my life is safe. Those who know me know that I am working with a tremendous group of colleagues at the Latino Policy Forum and at Illinois Unidos to make sure that everyone else has this same opportunity, that everyone has access to the vaccine and to COVID testing. Our essential workers especially need this opportunity. They are the ones who are keeping our economy running and who have the highest rates of COVID. They do not have the luxury of working from home. They are taking care of our children, working in our factories, preparing and serving our food, and doing the cleanup and the disinfecting that COVID requires. Latino communities and communities of color have been disproportionately impacted, and too many have suffered and died. Latinos have been infected with COVID at a far higher rate than any other racial or ethnic group. And nationwide, Latinos have experienced more COVID deaths than any other minority racial ethnic group. If you are hesitant about getting vaccinated, My message to you is this: the vaccine is safe and it saves lives. COVID is dangerous and it kills. The vaccine is free. For more information, please go to the City of Chicago website, chicago.gov/COVID-vax. I am so pleased that Mayor Lightfoot will prioritize our hardest hit communities to receive this vaccine. Please, I implore you, take the vaccine and keep your family and loved ones safe. Thank you.
Thank you and good afternoon. I'm honored to be here today before you and with some phenomenal women and men here today. But as a black man, I think what I did earlier speaks much more volumes than anything I can ever say today. Getting this shot is something I think that is important to note, and I was glad to get it in public before cameras to show that, one, it is safe. This is something that I think is extremely important, but it does not do a couple of things. It does not excuse our discussions. It does not solve our problems of racial inequity, does not solve our disparities in health, economics, education, culture. We're going to continue to have those conversations. But what's important right now is the vaccine is safe. If you're not sure, do your research. Look at all the well-respected articles and information that's out there and take it from yourselves. But what I want to be able to do is get this vaccine to save lives. Not just my life, my family's lives, my friends' life. I want to be able to shake hands once again. I want to be able to hug people once again. This is something that I miss greatly, the interactions. And this virus is terrible. It's tearing us apart. So let's get education, let's get the vaccine, but let's continue the conversation. Because inequities have not gone away because the vaccine is here. Let's continue our conversations on health disparities, on economic disparities, on all types of things that affect us, particularly the black and brown individuals here today. But again, let's look at this as a positive move forward for our city and our nation. Thank you.
Good afternoon. Happy to take any questions you have.
Hi, Meredith Barrick with CBS 2. Let me know if you can't
I can
quite
hear you
hear
fine.
me. Okay, perfect. Want to touch on the supply versus demand situation. You guys noted that with the amount of vaccine doses that the city is getting right now, there's not going to be enough to vaccinate people for quite some time. Is there any concern that folks, especially since there is a rush now that 1B is open, that people are signing up for appointments for doses that may not exist?
No, I don't think so. Obviously, we built the infrastructure. We want to make sure that we encourage people. And we're just going to keep pushing and demanding that the federal government step up and do its part. We've also had, I think, productive conversations with the county and the state. You note that we always talk about the number of Chicagoans that have been vaccinated, but we've also been vaccinating people that don't live in Chicago. That's fine, but we need to make sure that when we're picking up the slack for others, that we're sharing in the doses that would have otherwise gone to residents that live in suburban Cook County or across the state. So here in Illinois, I think we've got good dialogue, good collaboration going, but fundamentally, the federal government has got to step up. I can't tell you what it felt like about a week ago to learn that the 20 million doses that the Trump administration had promised never materialized, and that they essentially left office leaving the cupboard bare. That's not acceptable. So the Biden administration didn't create this problem, but just as we've seen here in Chicago, when you're the one in charge, you wear the jacket. So we have to keep pushing, and I have every confidence. We've had lots of dialogue with people that are in the Biden administration, some of whom are from Chicago, some of whom are from Chicago public health system, but they understand the urgency that they've got to deliver. We can't preach the gospel of the vaccine and not be able to deliver. That's not something that I'm going to accept, and nor should anyone. So we got to press them. use all the tools in the toolbox at the federal level. Let's get more vaccine. Let's get it here and across the nation as quickly as we can so we can get critical mass of people vaccinated.
Wonderful. I'm going to get right to the questions. We have about a scroll's worth.
Sure.
So,
Sure.
Bill Cameron from WLS, touching on the school reopening impasse. Any chance there is a way to do remote instruction to in-class CPS students?
Well, I don't think that works, and that's certainly not the optimum situation. Look, we've had a lot of very productive conversations with the folks at CTU. They were bargaining literally every day over the weekend, all last week, every day, and we're going to continue to be at the table until we get a job done and get the remaining issues resolved. You know, look. The reality is that in the course of this pandemic, there have never been any easy choices. There just haven't been. There's no easy choices now. And I think in partnership with the CTU, if we come together in good faith, I have every confidence whatsoever that we will get something done that obviously protects their members, but also gives families the options, if it's right for them, to be able to send their children back to in-person learning. You know, we're in a critical point in our fight against this virus. We're going to prioritize a number of different people, teachers included, and I'm particularly those, I want to give a shout out to those that have been doing, working in daycares all across the city since March, have been out there supporting children and supporting families. We want to make sure that those folks are prioritized, but I'm confident we'll get something done at the bargaining table.
Okay. Dr. Arwady, this next question is you from Amy Jacobson at WIND. A few months ago, you said you would not grant CPS athletes practice days when the rest of the state did. You said back then, quote, "Until people are in school learning, I won't allow sports." Now that CTU is refusing to go back and the suicide rate has increased due to isolation, will you grant Chicago to play when we reach phase 4?
So all education decisions, right, we don't make them just about private, just about parochial. We make the decision sort of for the city, and we really have deferred to the Illinois State Board of Education and to the Illinois Department of Public Health on these issues, particularly related to sports. We know that there's a lot of pieces that fall within this, and we think it's important to be aligned on those. So we are following the lead of the state guidance on that.
Okay. Becky Vivea from WBEZ is curious, why have more vaccines gone to predominantly white zip codes? Why is the city seeing racial disparities in vaccine distribution during the first month of rollout? And I think you guys answered this with your new initiative. Will you be allocating a specific percentage of the city's allocation to the hardest hit communities, which I believe you touched on earlier?
Do you want me to start that? Okay. So, you know, first and foremost, I want to be very clear that we keep track by where people live. So all of the, every way we always report is not based on where the person got the vaccine, but where they live. And so it's not that we haven't pushed vaccine to given communities, but all of 1A, as a reminder, has been about healthcare workers. And we know that there are the way healthcare workers live in this city, and the way that we've seen healthcare workers perhaps be first to raise their hand to get the vaccine has not been equitable. And so this is where I was making this point of we're not saying no, but not yet. We heard from a lot of healthcare workers that they wanted to get the vaccine, but they just wanted to wait a few weeks and make sure that all of their colleagues had gotten that second dose. I'm hopeful that we will see increasing rates there, even among our healthcare workers. But there is a lot of work to do. As we move into 1B, we have much more opportunity to actually focus vaccine because we have a lot more providers, right? More than 400 across the city. And so we will continue to push through employers like we did on the healthcare in those other settings, but there's much more work sort of in community that will come along with this.
Wonderful. I'm going to have you stay up there. This is another question for you from Karen Jordan from ABC7. What are your thoughts on people wearing double masks to protect themselves about COVID? Is this something you recommend?
So I've certainly been following the information on that. The most important thing always is if people are taking COVID seriously, their risk is really quite low. Where we see people get into trouble is where they think they don't need the mask, they can get in big gatherings, they can put aside the things that we know work. There has been some thought about this second dose, the second masking because of variants coming and some of that. If people feel more secure wearing a second mask, they can. I am wearing a single mask at this point. If there is guidance that comes out that's based on some studies and some evidence that the CDC recommends, we would make that updated recommendation. But at this point, we know that where people wear masks, they do the distancing, they wash their hands, they don't gather, all the things that we've started to take for granted, the risk of COVID spread is actually very low.
Wonderful. Sarah Schulte from ABC7. Chicago residents are seeing their friends and relatives get vaccinated in other states much more quickly than here. You're asking people to be patient, but do you think the rollout has been too slow?
I don't. I have to say, when I was listening to you ask that question, I kind of feel like the conversation that my wife and I have with our 12-year-old all the time. I can't account for what's going on in other states. All I can account for is what's going on here. What I know is we started preparing for vaccine distribution at the end of the summer. We started building out the infrastructure, thinking through what the sequencing was going to be, what we would need to do to make sure that we reached out to healthcare workers and the places that were going to be most challenging for us. So our issue isn't the process by which we're getting it. Our issue is we need more vaccine. And if we get more vaccine, we'll be able to accommodate everyone that wants it. And, as we said, we announced our Protect Chicago Plus initiatives because we see the disparities in the way the uptick of the vaccine. But even with that, I think we've got a very good plan. We're working with colleagues on the ground. We're starting this work this week in Belmont-Cragen. We've been in Belmont-Cragen now 4 months working on education, going door to door, standing up testing facilities. So we're using those networks that have already been in place to then layer onto that the distribution and education regarding the vaccine. So I feel very confident and comfortable with the pace at which we were doing. We are the 3rd largest city in the country, so we can't compare ourselves to other locations that are much smaller, that are not as diverse, that don't have the kind of challenges that we do.
Mm-hmm. Amanda Vinicki from WTTW, how are you monitoring who signs up to get the vaccine via getvaxshy.gov? If people used an access code but are not part of the group for which the access code was intended, for example, teachers signing up via the SEIU access code, can they still get the vaccine or do they need to cancel? Are other access codes being given to different populations?
No one gets to jump the queue. So we're monitoring it very carefully. We want to make sure that we are being fair and equitable. We place a lot of emphasis on making sure that we get this right. No one gets to jump the queue.
Okay. Natalie Perez from Univision. Half of the students who chose in-person learning did not show up last week on average, according to data released by CPS. Do you believe it is necessary do all the teachers need to attend their classroom instead of give the opportunity those who want to be vaccinated first, then return to in-person learning?
That question's a little confusing, but look, the bottom line is this. We want to give those families for whom in-person learning is the right option, the option to do so. Obviously, when we think about doing that, we've got to think about what all the component parts of that are, right? It's not just students showing up. It's not just teachers showing up. It's the whole school system, ecosystem that is necessary to make that learning experience fruitful and worthwhile. So CPS has been working really, really diligently from the very beginning of this pandemic, but certainly through this school year, and particularly over the last couple of months, to make sure that we're reaching out, we're educating people, we're answering questions, we're listening and being responsive. And it's not unlike what we've been talking about today about vaccine hesitancy. Folks are a little nervous and tentative. I think as they start to see, as we've seen, now I think we're in week 3 of students being back, things are going fine. So I think we're going to start to see more and more, and I'm hearing from more and more parents about the fact that they want to to be able to have that opportunity if it's right for them. For some people, it's not going to be right, that they're going to want to keep their children in remote learning, and we have to respect that. But for the ones that want to come back to in-person learning, we got to give them that option.
Okay. We had a lot of questions about CPS and CTU, how negotiations are going. Is there a plan in place for teachers if they don't return to the classroom come Wednesday? And what are your thoughts
So
about?
I'm going to focus on glass half full. We made a lot of progress, I think, over the course of the weekend. And I feel confident that if we come to the table every single day with a focus on putting our kids first, doing what needs to be done to protect our teachers and the school community, that we are going to get a deal done.
Okay. And then Aaron Gettinger from the Hyde Park Herald wants to know why restaurant service workers aren't included in Phase 1B when restaurants and bars were just reopened.
I'll start and then I'll invite Dr. Arwady, who can explain it much more cogently than I do. If you look at the population of who are the restaurant workers, they will be covered through our Chicago Plus initiative. I have no doubt about that. As Dr. already said, we have a very good sense of where workers live, what neighborhoods they're coming from. So I feel very confident that we're going to reach a huge cross-section of those workers through the equity work that we're doing in vaccine distribution. But maybe Dr. already wants to add a few more details to that.
Yeah, I can just add, we actually have mapped and are making available online the distribution of these different essential worker groups across Chicago, and really looking to see where there is overlap with communities that will be Protect Chicago Plus. The other thing I would say is that the prioritization really in 1B is our jumpstart phase. These are the settings where we have seen the COVID risk be highest. And so there is always COVID risk. Education is also included in there because it is so essential in terms of getting our society really, back to normal. But besides education, the others are in there mostly because it's where we've seen very large outbreaks. And again, getting vaccine into the places where we've seen a lot of outbreaks and a lot of risk does the most to quickly decrease the risk of COVID for everybody. And so that's why those groups are prioritized. Others will be in 1C. There will be other opportunities.
Thanks. Thank you.